Hello, my name is Aaron Jones. I'm a student physical therapist assistant at Jefferson State Community College. Today I'll be informing you on the subject of vancomycin resistant enterococci. For the remainder of this presentation, I'll refer to this as VRE. First, before we dive into the subject of VRE, I think we should discuss what enterococci are. Enterococci are bacteria that are naturally found in the intestines and female genital tract, but cause inflammation and blood infection if introduced elsewhere in the body. Now that we have a basic knowledge of what enterococci are, let's move on to how VRE can be detected. The National Committee for Clinical Laboratory Standards recommends the use of agar screening plates to test resistance to vancomycin. As you see here, these are actual agar screening plates that are used to determine the resistance to vancomycin. These slides are usually set aside in a sterile environment under ultraviolet light for 24 hours to make the detection of vancomycin resistance more accurate. Next, let's discuss the populations that tend to be susceptible to VRE. Adults that have been hospitalized in acute care or long-term care facility settings are typically the population of patients that are affected due to the fact that they are most likely in a state of weakened immunity, whether it be because of a patient having a major surgery or because they are elderly. All right. Let's move on to the medical prognosis. All right, a patient with VRE. The prognosis of VRE infection is difficult. The treatment process of VRE is very challenging due to the fact that VRE can become resistant to most antibiotics. Okay, VRE is only moderately resistant to ampicillin, though, which allows for a combination of antibiotics to be used to treat VRE. Okay. Next, let's discuss some common medical treatments for VRE. First, the focus points of the infection that are able to be drained should be drained. Next, if any catheter or foreign body that is infected should be removed from the body. This is very important. When treating an enterococcal infection, the combination of a cell wall active agent and aminoglycoside are typically used. If the infection is highly resistant to either agent, then the treatment will not work. A treatment that has shown positive results is the use of vancomycin combined with B-lactams. Now, let's discuss why we, as physical therapist assistants, get involved with patients with VRE. Patients with VRE are typically hospitalized for a prolonged period of time, which then will cause them to be debilitated in a debilitated state if they are not active. Impairments that the patient may experience due to prolonged hospitalization include, but are not limited to, decreased strength, decreased range of motion, and difficulty breathing due to deconditioning. Let's discuss some functional limitations. Functional limitations that are present could include decreased balance, ability to do transfers, gait, and bed mobility. And due to these impairments and functional limitations, the patient may experience the inability to perform activities of daily living and social roles, as well as activities. All right. Here's how physical therapy can help. We can do some general strengthening exercises with patients to address the impairments that they have. For example, hip extensors can be strengthened to help the patient ambulate. This will also help the patient increase any range of motion restrictions that they have. The ambulation will then address the deconditioning of the patient. Doing this one simple exercise will address the patient's impairments, functional limitations, and disabilities. Another exercise that can be done is passive stretching at the hip and knees to decrease the risk of contractures. Alright, some implications that the therapist should be aware of with patients with VRE are lab values. Physical therapist assistants should be aware of the patient's white blood cell count. The white blood cell count could be elevated due to infection. If the patient has a fever and a white blood cell count greater than 10,000, then exercise is contraindicated. You should not do exercise if you have these lab values. Okay? The physical therapist should always practice standard precautions with VRE patients due to the fact that the patient has a weak immune system. Okay. Two limiting factors when it comes to testing or treating patients with VRE are fever and susceptibility to infection. If the patient has a fever and is susceptible to infection, then it will make physical therapy difficult due to the fact that the patient may not be able to participate in therapy because of abnormal lab values. Excuse me. All right. Now we're just gonna. Now that we've discussed this, we're gonna do a video, which will be an overview of what we've talked about so far. All right. Let's go ahead and watch this video.
Enterococci are bacteria that are normally present in the human intestines, female genital tract, and are often found in the environment. These bacteria can, however, sometimes cause serious infections. Vancomycin is an antibiotic that is used to treat some drug-resistant infections caused by enterococci. In some instances, enterococci can become resistant to this drug and are thus called vancomycin-resistant enterococci, or VRE. Most of these VRE infections occur in hospitals. VRE can live in the human intestines and female genital tract without causing disease. However, sometimes it can cause infections of the urinary tract, the bloodstream, or wounds associated with catheters or surgical procedures. VRE is often passed from person to person by the contaminated hands of caregivers. VRE can get onto the caregiver's hands after they have contact with other people with VRE or after contact with contaminated surfaces. VRE can also be spread directly to people after they touch surfaces that are contaminated with VRE. VRE is not spread through the air by coughing or sneezing. If a patient or someone in a household has VRE, the following are things that can help prevent the spread of the bacteria. Keep hands clean. Always wash hands thoroughly after using the bathroom and before preparing food. Clean hands after contact with persons who have VRE. Frequently clean areas of the home, such as bathrooms, that may be contaminated with VRE. Wear gloves if hands may come in contact with bodily fluids that may contain VRE, such as stool or bandages from infected wounds. Always wash hands after removing the gloves. If someone has VRE, be sure to tell healthcare providers so that they are aware of the infection. These are just a few things to know about VRE in healthcare environments. To learn more about environmental infectious diseases and pathogens, or indoor air quality testing services and prevention measures, please visit the websites shown on the screen.
Okay. In conclusion, now that we know about vancomycin-resistant enterococci and that they can be dangerous organism to patients that are admitted to acute care facility as well as long-term care facilities, we know that there is evidence as well as hope that this organism can be fought. We in physical therapy can play a huge role in helping a person recover and regain their lives after such a terrible incident that occurs. Patients have a hope to get back to their normal lives, and to be a part of that recovery process as a member of the physical therapy world is an amazing and opportunistic responsibility. Thank you for spending just a small amount of time with me to learn about this very important subject. Thank you.